Clear signs of schizophrenia. Schizophrenia is a mental disorder that affects a person's ability to think, manage emotions, make decisions, and relate to others. It is a serious condition that can be debilitating and even life-threatening. While there's no single cause of schizophrenia, it is believed to be a combination of genetic and environmental factors. People with schizophrenia often have a chemical imbalance in the brain, and they may also have a history of trauma or abuse. The symptoms of schizophrenia can be divided into three categories: positive, negative, and cognitive. Positive symptoms are those that are not seen in healthy individuals, such as hallucinations and delusions. Negative symptoms are those that healthy individuals have but are lacking in people with schizophrenia, such as a loss of interest or pleasure in activities, or difficulty speaking or showing emotions. Cognitive symptoms are those that affect a person's thinking, such as problems with memory, attention, or decision-making. In this video, we'll be going over 10 clear signs of schizophrenia, so watch till the end. Here are 10 clear signs of schizophrenia. Number 1. Hallucinations. Hallucinations are one of the most well-known symptoms of schizophrenia. A hallucination is defined as a sensory experience that occurs in the absence of an external stimulus. In other words, it is a false perception that someone experiences even though there's no actual physical object or event that is causing it. People with schizophrenia often have visual or auditory hallucinations. This means that they see or hear things that other people do not. For example, they may hear voices that are not there, or see people who are not there. Hallucinations can be very frightening and may cause a person to feel isolated and alone. If you or someone you know is experiencing hallucinations, it is important to seek professional help. Hallucinations are often a sign of a more serious condition and can be very difficult to deal with on one's own. With treatment, people with schizophrenia can learn to cope with their hallucinations and live healthy, productive lives. Number 2. Delusions. Delusions are a common symptom of schizophrenia. A delusion is a false belief that a person holds despite evidence to the contrary. For example, a person with schizophrenia may believe that they are being followed or watched, even though there's no evidence to support this belief. Delusions can be very confusing and distressing for both the person with schizophrenia and their loved ones. It is important to remember that the delusion is not real, and that the person with schizophrenia is not deliberately trying to deceive you. They are simply reacting to what they see, hear, or feel in their environment. They may also believe that they have special powers, are in danger, or are being persecuted. These beliefs are not based on reality and can be very distressing for the person with schizophrenia. If you or someone you know is experiencing delusions, it is important to seek professional help. Delusions can be a sign of a serious mental illness and can be very disabling. Treatment for schizophrenia can help manage delusion and other symptoms. Number 3. Disordered thinking. Disordered thinking is a common symptom of schizophrenia. People with schizophrenia often have trouble thinking, organizing their thoughts, and speaking coherently. This can be difficult for them to communicate with others and to function in day-to-day life. They may also have delusions or hallucinations. While disordered thinking is a hallmark symptom of schizophrenia, it is important to remember that not everyone who experiences disordered thinking will develop schizophrenia. Many other mental disorders can cause disordered thinking. So, if you or someone you know is exhibiting signs of disordered thinking, it is important to seek professional help. Disordered thinking is a serious symptom that can have a major impact on a person's life. Early diagnosis and treatment are essential for managing the symptoms of schizophrenia. Number 4. Paranoia. Paranoia is one of the most common symptoms of schizophrenia. It is defined as a feeling of intense fear or suspiciousness that can cause a person to feel isolated and alone. People with schizophrenia may believe that other people are out to get them, or that they are being watched or followed. This can be a very frightening experience and can make it hard for a person to function in everyday life. Paranoia is a symptom of schizophrenia, a mental illness that affects about 1% of the population. If you or someone you know is experiencing paranoia, it is important to seek professional help. Paranoia is a serious symptom that can lead to social isolation, anxiety, and even violence. Number 5. Social withdrawal. One of the symptoms of schizophrenia is social withdrawal. This means that people with schizophrenia may avoid social situations, withdraw from activities they once enjoyed, and have trouble maintaining relationships. People with schizophrenia may withdraw from others because they feel suspicious or paranoid. They may also withdraw because they are experiencing hallucinations or other delusions. Social withdrawal can be a sign that someone is starting to experience schizophrenia, so it is important to be aware of this symptom. Individuals with schizophrenia often withdraw from social activities and lose interest in things that they used to enjoy. This can make it hard for them to maintain relationships and can lead to isolation. If you notice that someone you know is withdrawing from social activities, it could be a sign that they're struggling with schizophrenia. If you or someone you know is experiencing social withdrawal, it is important to seek professional help. Number 6. Isolating oneself. There is evidence that suggests that isolating oneself is a sign of schizophrenia. Various studies have shown that people with schizophrenia are more likely to isolate themselves from others. This isolation can be both physical and emotional. So why does this happen? There are a few theories. One is that people with schizophrenia are trying to protect themselves from the outside world. Another is that they are trying to protect others from themselves. Various studies have shown that people with schizophrenia are more likely to live alone, have fewer friends, and be estranged from their families. This isolation can lead to further mental and emotional deterioration, making it more difficult for people with schizophrenia to recover. While social isolation is not always a sign of schizophrenia, it is often one of the first symptoms to develop. If you or someone you know is displaying signs of social isolation, it is important to seek help from a mental health professional. Isolation is a serious symptom of schizophrenia and can worsen the condition if left untreated. Number 7. Problems with speech. There's a growing body of evidence that suggests that problems with speech are a sign of schizophrenia. Studies have shown that people with schizophrenia often have difficulty with various aspects of speech, from forming words correctly to stringing together coherent sentences. This difficulty can make it hard for people with schizophrenia to communicate effectively with others, which can lead to social isolation and other problems. Problems with speech can be caused by a variety of factors, including stress, anxiety, and even fatigue. If you or someone you know is having difficulty with speech, it is important to seek help from a mental health professional. Speech problems can be a sign of other mental health conditions as well, so it is important to get a proper diagnosis. With proper treatment, people with schizophrenia can lead happy and fulfilling lives. Number 8. Pacing or fidgeting. There's a common misconception that people with schizophrenia pace or fidget as a result of their condition. However, this is not the case. In some people with schizophrenia, these movements may be due to an excess of energy, while in others, they may be a way to cope with anxiety or stress. However, pacing and fidgeting is not always a sign of mental illness, and it can also be a normal part of some people's personalities. If you are concerned that someone you know is showing signs of mental illness, it is important to speak to a professional for a diagnosis. Number 9. Unusual behavior. There is a widespread belief that people with schizophrenia exhibit strange or unusual behavior. A common symptom of schizophrenia is unusual or abnormal behavior. This can manifest in several ways, including acting out unusually or inappropriately. This can manifest itself in several ways, ranging from make-believe play acting to outbursts of anger or violence. Withdrawing from social interaction. One of the most striking symptoms of schizophrenia is withdrawal from social interaction, as people with schizophrenia may feel disconnected from the world around them. Having delusions or hallucinations. Delusions and hallucinations are common symptoms of schizophrenia. A delusion is a false belief that a person holds to be true, despite evidence to the contrary. A hallucination is a false sensory perception, such as hearing voices or seeing things that are not there. Exhibiting disorganized thinking. Disorganized thinking is a symptom of schizophrenia that can manifest itself in several different ways. Patients with this symptom may have difficulty organizing their thoughts or speaking clearly and cohesively. This can make it hard for them to communicate their thoughts and ideas to others. Disorganized speech. A person with schizophrenia may have difficulty organizing their thoughts and speaking coherently. This may include jumping from one topic to another or speaking in gibberish. Disorganized behavior. A person with schizophrenia may have difficulty completing tasks or may behave bizarrely or unusually. This may include dressing oddly or inappropriately, or engaging in self-harmful behaviors. If you or someone you know is exhibiting any of these symptoms, it's important to seek professional help. Early diagnosis and treatment of schizophrenia can improve long-term outcomes. Number 10. Ineffective coping mechanisms. There are many signs and symptoms of schizophrenia, and one of them is ineffective coping mechanisms. People with schizophrenia often have difficulty coping with the stress and demands of everyday life. This can result in them withdrawing from social activities, becoming isolated, and experiencing a decline in their overall functioning. People with schizophrenia might turn to substance abuse, self-harm, or other risky behaviors as a way to cope with their disorder. These behaviors can often make the symptoms of schizophrenia worse and can lead to dangerous consequences. If you or someone you know is showing signs of ineffective coping mechanisms, it is important to seek professional help. This is especially true if the person is also exhibiting other symptoms of schizophrenia, such as paranoia, delusions, or hallucinations. Early intervention can make a big difference in the course of the disorder, so don't hesitate to reach out for help if you or someone you know is showing signs of schizophrenia. Schizophrenia is a serious mental illness that affects a person's thinking, feelings, and behavior. Symptoms may include delusions, hallucinations, disorganized speech, and decreased participation in activities. Schizophrenia requires long-term treatment, and there is no known cure. However, with proper treatment, many people with schizophrenia can lead productive and fulfilling lives. If you enjoyed the video, be sure to like and subscribe to our channel so you don't miss any future videos. And share your thoughts on this in the comment section below. Thanks for watching.